In the United States, the Obama administration's plan for health care reform has cleared its final hurdle by winning approval from the highest court in the land. It's expected to provide millions of uninsured Americans with health insurance coverage. Proponents say it will improve access to health care and has brought the country's health care system in line with international standards. Opponents say it's too expensive and bureaucratic. Some doctors say they may abandon their practices altogether. CCTV's Liling reports on the great divide in America over what some are calling Obamacare.
That's why he gave me this one.
You just need it at this point once a month, right?
Dr. Richard Liling, director of outpatient dialysis at New York's Beth Israel Hospital, takes care of kidney patients but says the U.S. healthcare system needs attention too.
And the best way to get health care to the greatest number of people is through the free market and allow that to thrive and to function the way it should. The answer is not through government coercion and government central planning. That has never worked and never will work.
The law allows young adults to remain on their parents' policy until they turn 26. It keeps insurance companies from discriminating against pre-existing conditions or gender, and it promises to fund improvements in existing facilities and create new health centers. However, Dr. Liling disagrees with the central tenet of the law, the so-called individual mandate requiring all Americans to have insurance or face a penalty. Although subsidies will be provided, Dr. Liling says the plan gives the government too much power over healthcare decisions, such as what procedures are considered necessary. That's a decision physicians alone should make, he says.
The situation could get worse. A survey by the Doctor-Patient Medical Association found that 83% of responding physicians were considering leaving their practices as a result of the law.
While the survey was criticized for having been completed largely by doctors who oppose Obamacare, it does paint a picture of increasing pessimism in the industry, with blame directed at the government. America may be the richest in the world, but ranks 37th out of 191 countries in healthcare, according to the World Health Organization. France was number 1. Professor Patricia Pittman of George Washington University says the French system does have better health outcomes thanks to its universal healthcare. But the Affordable Care Act has brought America's healthcare system more in line with international standards.
We will not have full universal health care in this country. We'll have 33 million out of about 49 million uninsured now covered under the insurance reforms that will be implemented in the next several years. But we will be much closer to where other industrialized countries like France are.
Healthcare reform this election year will be monitored closely, not just by politicians and the voters who elected them, but also by a medical community sharply divided on its merits. Liling, CCTV, New York.